Okay, so this brings us to the OBGYN section of the protocols, and there are two protocols within this section. The first is Protocol 52, Childbirth, Labor, and Delivery, and no real change from your current protocols. Protocol 53, Pregnancy-Related Emergencies, for our intermediate and paramedic providers, defines preeclampsia as a systolic blood pressure greater than 140 or a diastolic blood pressure greater than 90 in the absence of seizures. And in this section of the protocol, this is the one place where you must get prior medical direction before administering mag sulfate. And that is only in preeclampsia. The WMD ChemPAC protocol is Protocol 54. This is for all provider levels, and this deals with your organophosphate poisonings. And the medication is the Duodote, which is a medication that contains atropine and 2-PAM chloride to combat organophosphate poisoning. Okay, now we're on to the procedures section of the protocols, and there is a disclaimer. Procedures may only be performed as trained, authorized by an OMD, and in accordance with the Virginia Scope of Practice maximums. The procedures listed here contain general instructions and protocols for their implementation. If using equipment not listed here, or in the event of conflicting instructions, follow the manufacturer's suggested settings and/or procedures. Our first procedure in this section is 12-lead ECG, and this now is for all provider levels, the acquisition of a 12-lead. For our EMT, enhanced and advanced providers, we will be focusing heavily on this in your skills portion of the training. For our intermediate and paramedics, we have the 12-lead ECG right side and posterior. Procedure 2 is airway basics. This is, of course, for all provider levels. Procedure 3 is our airway blind insertion airway device, the King Airway. Again, all provider levels. And Procedure 4, CPAP, all provider levels. Procedure 5 focuses on airway cricothyrotomy for our paramedics. Procedure 6, airway foreign body obstruction. Of course, all provider levels at the basic level and intermediate and paramedic have the ability to use direct laryngoscopy with the McGill forceps. Protocol 7 is airway intubation nasotracheal. And for paramedic, the patient must be over the age of 12 to nasally intubate. Protocol 8, airway intubation orotracheal. For intermediate, the patient must be over the age of 12 to intubate orally. And paramedics can intubate at any age. Procedure 9 is airway nebulizer, and this is for all providers. Procedure 10, airway suctioning, which is broke down between basic and advanced suctioning, and it is for all provider levels. Procedure 11 is meconium aspiration airway suctioning, and that is at the paramedic level. Procedure 12, blood glucose analysis, all provider levels. Procedure 13, capnography. This is at all provider levels. Procedure 14, cardioversion at the intermediate and paramedic level. Procedure 15 is chest decompression, again, intermediate and paramedic level. Procedure 16, defibrillation automated, is all provider levels. Procedure 17, defibrillation manual, intermediate and paramedic level. Procedure 18, external pacing, again, intermediate and paramedic level. Procedure 19 is the Lucas II device, and this is at all provider levels. And Procedure 20 is the medication administration intranasally, and this is at the enhanced through paramedic level. Procedure 21, the medication administration injections, or the IM administration, is enhanced through paramedic level. Procedure 22 focuses on the PET oxygen mask, and we're going to focus on this and train you on this during the skills portion. And this is at all provider levels. Procedure 23 is stroke screening, or the Cincinnati Pre-Hospital Stroke Scale, all provider levels. And Procedure 24 is venous access, external jugular access, and this is at the paramedic level. Procedure 25 is the venous access, intravenous access, which is enhanced through paramedic level. Procedure 26 is the venous access interosseous access using the EZ-IO gun. This is enhanced through paramedic level. However, local anesthetic with lidocaine is only at the intermediate and paramedic level for all conscious patients. The enhanced advanced provider will be starting an IO on unconscious patients only. Procedure 27, wound care general, all provider levels. And procedure 28, wound care taser probe removal. And again, as we mentioned earlier, we will be focusing on that during the skills portion. Procedure 29 is the wound care tourniquet, and this is at all provider levels. And you'll notice during the skills portion of this training that your tourniquet is blue, and that is because it is a training tourniquet. Okay, so we're going to quickly look at the policies section of the protocols. Again, this section covers many policies that will guide your decision making as a provider. However, you, as the provider, are responsible for being familiar with all policies within these protocols. Many of them pertain to operational aspects of emergency medical services within Fauquier County. Examples of operational policies are air medical utilization, ambulance patient destination, criteria for death, deceased subject, direct admissions, discontinuation of pre-hospital resuscitation, extraordinary care not covered by these protocols, hospital reporting and online medical control, inability to carry out a physician's orders, and inter-facility transport of acutely ill or injured patients. Continuing on with operational policies, medical emergency custody orders, refusal of treatment and transport, treatment of minors, and verification of on-scene medical personnel. Also within the policy section, there are many policies that cover legal concerns that you may have as a provider, abuse and neglect, documentation and confidentiality, impaired field provider, infant abandonment, infection control, provider field status, quality improvement, and the Virginia DNR orders. Now we're going to look at the medication reference section. This section covers all medications within these protocols. And there's also a pediatric color-coded medication reference, very similar to the Broslow tape. Just a reminder that the weights are averaged at the top of the color-coded medication references. The EMS reference section. Inside this EMS reference section, there is EMS resources, phone numbers, addresses. There's area hospitals. There's a dopamine drip rate chart. There's an IV drip rate chart, a GCS chart, an APGAR score, a trauma score, field trauma triage, field stroke triage decision scheme, the rule of nines, and start and jump start triage. Okay, this concludes Module 1, Introduction of the Protocol Training. Continue to the Provider Appropriate module to complete the online portion. EMTs, enhanced, and advanced providers will go to Module 2, and paramedic and intermediates will complete Module 3. Again, thank you for participating in this training.